Hey, good afternoon. I'm in a secret location, staged just for you guys. I'm clandestine right now. Very interesting report I have today. 2 patients were seen in Manhattan and were told they needed rotator cuff repairs. Each of them knew me through mutual friends and connections. I asked them to come to my office and told them that if I could not help them, I would refer them directly back to the hospital for special surgery for surgery. Each person was between 35 and 45 years old. These guys are very active in hunting, fishing, skiing, both water skiing and snow skiing, alpine and Nordic in fact. Each is right-hand dominant, each has severe shoulder pain. I'm telling you this information because how common is it to have shoulder pain? They can't sleep on their right arm at night, they can't raise the arm over the head completely, and they have an extremely hard time putting the arm behind their back. So for 100 reasons, obviously this is annoying, and this would annoy you too. And I see this in the office all the time, but I can't tell you how many people don't come to me because they think they need to go to an orthopedic surgeon for this, or a so-called shoulder doctor. Well, in fact, a shoulder doctor is what I am. A shoulder surgeon is what an orthopedic specialist trained, fellowship trained in shoulder surgery is. What's the difference? The difference is that I am Picasso with a needle, and a great surgeon is terrific with a scalpel. So, the advantages: 1, I inject around the rotator cuff tendon sheath, you don't feel pain, you get better, in my experience, 98% of the time. If you don't go to me, you are probably going to be offered physical therapy. Therapy may or may not work, maybe partial relief. You may take NSAIDs of any type, you may take pain relievers of any type. Then you'll get an injection from the orthopedic shoulder surgeon, who is not as skilled as I am. The shot will usually not work. I'll give it 50-50. And then you'll be told, well, the shot didn't work, therefore it's time for surgery. You'll have your rotator cuff repair, and if you're lucky, in a year you'll be back to normal. If you're not lucky, you'll be back to my office saying, gee, what can you do for me now? Okay, I think you've got the point of this story. Shoulder pain, can't sleep on that side, can't put it above the head or behind the back. That's typically rotator cuff tendonitis. If you're suffering from those symptoms and you need relief, 9 out of 10, I get better. If not 99 out of 100. So, give us a call, ask questions, come on over. And remember, the most important thing I want to try and make clear here, you do not shop for an institution. There's no such thing as a good hospital. There's only a good doctor. There's no such thing as a good baseball team. It's not that the Yankees are good, it's because they have good players. The Phillies all of a sudden went from lousy to good when they get a guy for $300 million. I don't know if that makes them a good team. It means they have an expensive player. So hopefully you're getting the concept here. If I practice medicine in Vineland, then Vineland is good for shoulder pain. If I practice medicine in Missouri, then Missouri would have a good doctor for shoulder pain. I'm not the only good doctor. There's many. But since you're listening here and you're going to share this video and you're going to subscribe to my channel, you already know I'm good. Alright, have a great weekend. Enjoy yourself. No stress, it's the weekend. Take care.